Hi, I'm Tony Henderson, Chief Executive Officer of Classic Air Medical. My father started this company 30 years ago, and we've been able to keep that family feel with Classic, which I think is super important. And we've been able to run it as a family business. And even though we've grown, or we've gotten big, we've always been able to keep those family values that really the small communities really like.
Yeah, I'm Matt Stein, COO of Classic Aviation and parent company over Classic Air Medical. Well, Classic has a rich history as a provider of quality clinical care and safety of our pilots and their skills, getting those crew members to very remote places in some cases, and the helicopters, and also our fixed wing cadre of pilots as well. We have our Classic family values that are still with us even though we go through our growth process. It's a very important part of our company, and I think our customers see that.
Hello, my name is Wade Patton. I'm the Chief Administrative Officer at Classic Air Medical. I manage the clinical operations and the dispatch operations at Classic. We strive to make patient care our number one focus. We focus our efforts on creating a team environment at the local level to create the best systems for taking care of the patients at the local level. What that means is we work with the trauma teams. We work with the sending facilities and the receiving facilities. And we focus a tremendous amount of our time and energy on making sure that our staff is the best they can be.
One thing that I think sets us apart are our relationships in the community. Our employees live in these small communities. They're parts of the school, part of the community functions in town. And we just want a real good relationship with the general public, with the patients we serve.
I'm Laura Cross, and I'm the Administrative Director of Women's and Children's Services here at Valley View, and also Emergency Services. I work with Classic a lot, and I work with them in both the ED as we get patients moved in and out, and then I also work with them in a really fun role in the family birthplace. Well, they're a big benefit to our community because of our geography. We're pretty isolated. We also have some very high-tech services here available. The hard thing because of our geography is how to bring patients to us. So we're very proud of one of our big flagship programs is our heart and vascular program. And we have a lot to offer, but the geography makes it challenging to get the patients to us. So our patients are pretty far flung, and we've been so happy with the quality of service, and patients get to us in great shape. We are able to communicate and coordinate, and it's a huge service to our community that they're able to help us in this way.
Yeah, that's another thing that I think we've seen recently. Our competitors have had some talks with some high-level officers of other companies, and they were very curious to see how Classic is able to keep that reputation, where we have such good rapport with our communities and our customers, and it's something that's fairly highly sought after. It's just, I think, something that comes from a grassroots type of company like ours, from the ground up, and there is challenges of keeping that as we grow bigger and bigger, but it is possible. We've proven that, and I think we excel at it, and we'll continue to do so.
Safety culture is a very interesting thing. So it's the most important thing in our industry. So there is no reason to take a patient that is very, very sick and put them into a situation that is not safe for them. We haven't done them any good.
Hi, I'm Jim Webster. I'm the commander for Grand County Search and Rescue. In Utah, the commander is the person in charge of the team. So that's me. I work directly for the Grand County Sheriff in that role. The safety with Classic in my opinion, just working with them and watching them in action is a high priority. I've seen that on many calls that they've been involved with. Having Classic here, they are very willing to work with us in terms of making a safe mission for search and rescue for certainly the patient, medically speaking.
In Classic, we have a real passion for safety here. It's one thing that since I started with the company have embraced completely is our safety culture that we have. And it's shown in how we train our pilots. Our maintenance is done very safely and complete, and I feel very comfortable with our maintenance as a pilot. I have for over 25 years. And also on our clinical side too, patient safety is also very high up on our agenda.
So we have a focus of ours for the last 4 or 5 years is to be towards the front edge of new critical care and new clinical care quality. You cannot have expert level critical care without a robust quality program. What that means is you have to have the systems in place that will look for a bunch of different factors, and then you have to have the culture where people are okay with you looking at every detail of what is done. We have a very, very high standard at the moment of hiring these folks. They all have at least 3 years of critical care experience, or 3 years for the paramedics on a very busy ambulance service. First of all, before they come to us, most of them are the stars of whatever organization that they're in before they come to us and apply. And then from that point, we put them through a rigorous training process. Orientation is 6 months to a year, where they're with very expert level experienced teams that will make sure that they get to that level. So they really are the best of the best even before they walk through our door, and then we do everything we can to kind of accentuate that.
My name is Adam West. I'm the Chief Helicopter Pilot for Classic Air Medical. I oversee the rotor wing operations for Classic, oversee the training department. So our training department is very thorough in our off-airport training environments. We spend a lot of time training off-airport brownouts, whiteouts, so that we can respond without ground personnel being at the LZ prior to our arrival, and that we can do that in the safest way possible.
On the aviation side, we have 2 FAA Part 135 certificates we operate under. One would be the fixed wing, and one's the rotor wing certificates. And we have management teams that I work with very closely, directors of operations, directors of maintenance, and chief pilots that run those certificates very well, and we meet regularly and runs a very smooth operation, a very safe operation, most importantly. We spend more time training our pilots both in the details of the aircraft, the systems and all that, and also how to accomplish their mission as an EMS pilot, I think that most companies do.
Classic puts policies and procedures in place that allows the pilots to make on-the-fly decisions when they're out in the field in those remote areas to operate the helicopter and complete the task at hand in the most appropriate and safest way possible.
Hi, I'm John Park. I'm the Communications Center Manager for Classic Air Medical. One of the things I recognized early with being here is a challenge that our entire industry faces is making helicopters accessible to hospitals and 911 agencies, because every time they need a helicopter, by the very virtue of it, they are already in a difficult situation and they're usually overtaxed. So my role has been to create some solutions to make that easier for hospitals, particularly the nurses and doctors, to request access. So we have an application that we use for 911 agencies and some hospitals where they can track our aircraft once it's assigned to their call and see a real-time status, which is amazing for our 911 providers, being able to coordinate it on a large scene. And then we also have an easy button for hospitals in which a single press of the button will initiate a call on our end, and a simple 15-second call back from us within 60 seconds is all the information we need to get a helicopter on the way. One really awesome part about our communications center is we have really high levels of uptime, probably in the neighborhood of 99.9%, because we have a backup redundant system where we can go mobile within the span of about 1 minute, and we can take our communication center with us anywhere. So there's no issue like a fire or a natural disaster that can really take us offline. In the communications center, we track weather for the entire region, so before even a pilot gets to see the call, we're already ahead of the game on the weather, and our operations control specialist acts as an extra safety net for the pilot to be able to give them additional information that they might not be able to see at a quick glance at the weather. We also track not just in our region, but neighboring regions for any kind of potential areas coming up, such as presidential visits, wildfires, or other temporary flight restrictions. We can also monitor our entire fleet and crew from here, so we always know at any moment where any of our assets are or our crews.
I think one of the things that is most memorable to me is when there's several examples of this, but we've had situations where there is the local community has utilized all their resources. They have nobody else to turn to, and we're able to step in and help them. And that is not just in the transportation of patients. We have, on several occasions, been kind of a courier for lab studies where we're flying blood studies to major facilities so that they can get the lab studies and then get them back so they can treat their local patient.
The cool thing about being in these small communities is we are part of these small communities. We treat them like family, just like we treat our employees and our patients like family.
My name is Jen Sadoff, and I'm the CEO of Moab Regional Hospital. Oh, well, this is a tough experience. We had an employee who worked at Moab Regional Hospital who was killed in a base jumping accident. And his dad and brother came out here to Moab to be a part of the group that was scattering his ashes. And they were spreading his ashes from up where he jumped, actually as part of a base jump. And his dad really wanted to get up there, but did not have the mobility to do so. And because I have Tony's cell phone number, I called Tony up and said, can you fly his dad up there? And he, without hesitation, made arrangements to pick up his dad and brother and take them to the top so they could see Seth's last view.
One thing that always impresses other hospitals and organizations about us is our family values we have. Our mission statement, the first sentence is that we treat all our customers, our employees, and our patients like family. And that really resonates through the communities, and we've tried to live up to that. The cool thing also about being the CEO of a company like this is just seeing all the people you're able to help, and that's what it really comes down to.